I think yes, perfect. All right, so let's formally start. Thank you so much, everyone, for joining it. My name is Danish Khan, and I work at HTA Health Tech Academy as a product manager, product slash programs manager, which means that all of the programs that we have here at HTA, Surge Tech, medical assistant, patient care technician, healthcare IT, all of these programs, they were developed by me and my team, and we were supported by subject matter experts who were basically the experts in developing those programs. Ashley, who is our guest for this webinar, she's one of our subject matter experts, and she has been, I would say, the backbone of the content development side of HTA for the last 4 or 5 months. And I'm really, really honored to have her as part of the team, and also very happy to have her here today to talk about the medical assistant program. So I think let's start with Ashley's introduction, and I think I can't do the justice with that introduction. So I'll give it over to Ashley to introduce herself, and then we will start the webinar and discuss things that we are here to talk about.
Oh, thank you so much, Danish, for your kind words. My name is Ashley Hay. I'm a bachelor's prepared nurse. I specialized my bedside career for over a decade in oncology care from pediatric to adult, and got very specialized in the field. Decided to start a freelance medical writing company and consulting, helping educate healthcare providers and also patients. So I have, partnered with HTA here and been able to be a subject matter expert for them and multiple courses, which I've really enjoyed. So I am happy to be here today with all of you.
Perfect, perfect. Thank you so much. Thank you, Ashley. And just so we have something which you guys can expect from this session. This is an agenda. We might deviate from this agenda a little bit, but you will get to know about all these things that are here on the screen right now. And for all those who are here in this webinar, if you guys have any questions, you can use the question answer feature. We can answer the questions during the webinar as well. But we would recommend that you guys wait for the question answer session at the end so we can answer properly. Otherwise, during the session, if there are any questions, our team is here to answer it right away as well. You guys have already heard from Ashley with her introduction, and you guys can read it if you want. Take 10 seconds. Maybe she missed something that I'm sure she did. And then we can move on to HTA's introduction. HTA, which is Health Tech Academy, is basically the online healthcare training provider, which you guys are probably interested in, and you guys are thinking about enrolling into one of our programs. And we are based in Austin. That's where our headquarters are. Our team comes with more than 25 years of EdTech experience and more than 15 years of healthcare experience. That is cumulative with all of the team members that we have here at HTA. We currently have more than 20 coaches. All of these coaches have at least 10 years of experience in the healthcare sector. There are some which have a lot more experience as well. Like people like Ashley probably have a lot more, and they are there to coach the students one-on-one, which I think is something that we really, really take pride in. And we currently have more than 1,000 students enrolled in one of our programs, and we are enrolling about 100 students on monthly basis. In terms of our affiliations, we are affiliated with more than 20 hospitals, networks, and clinics across the US. And these are some of the certifying bodies that we are partners with: NCCT, NHA, AMT, and we are also approved through the Texas Workforce Commission, and we are also approved from the Workforce Commissions of different other states as well. And here are some other partners that you guys can see here as well. I think it's pretty clear that we offer online healthcare certification programs. We prepare you for the certifications that you can see on the screen right now. These are 10. We currently offer 13 different certification programs, but these are the ones that we that are probably like they are selling the most as compared to rest of them. So you guys can read these names: pharmacy technician, dental assistant, patient care technician, surge tech, medical assistant, healthcare IT, medical billing and coding. And you can read about all of these programs on our website at this link. It will be pretty straightforward. If you go to our website, you will be able to navigate through it, and you will be able to find this page very easily. But today, our focus is going to be on our medical assistant program. We want to understand what medical assistants do, what kind of job outlook it has, this career has, what kind of opportunities you can think of, what kind of training it is, what kind of life you can expect after becoming a medical assistant, and what kind of future you can think of after you have gained 3 4 years of experience, what kind of opportunities you can have in future. And Ashley would basically be talking about most of these things, and I'll be asking questions on behalf of all of the students. So that's what we are going to do. And I think let's start with the first question, which I think some of you guys might want to know, and that is, what really are medical assistants? And anything and everything that Ashley you can share about medical assistants and who they are.
Sure. Well, like I said, I've been a nurse for quite some time, almost 20 years, not to age myself, but I have worked with a lot of different kinds of healthcare providers, specifically medical assistants, along with a bunch of others. And I do realize also that, maybe there's a bit of overlap between this and some other very similar roles. For example, like a CNA, a certified nursing assistant. So while some overlap does exist, I think, there are very different scopes in terms of like what you are allowed to do and not to do. I also think it's very important that you know that these scopes can vary by state slightly, depending on, kind of where you perhaps live or what state you intend to practice in. Sometimes those can be different. So just make sure that you're familiar in checking your state specific regulations and requirements. But overall, I would say, medical assistants are very essential for us to, work as a team for the patient, but also just individually to help healthcare offices and really facilities run smoothly. So I would say an MA is really interesting because you can have a mix of clinical duties with also administrative duties. So you're kind of helping your team as well as helping the patients. And I think that that's where it really differs in terms of CNA versus MA. So in terms of administrative duties, which I know everybody doesn't always focus on in early, in introducing this kind of program, but I think it's great to know. You may be helping things like scheduling patient appointments, maybe sterilizing medical instruments, preparing exam rooms. So it's kind of like this really nice catch-all, and you're able to be utilized across the board. So you're not just kind of in patient care, you're not just in administrative work. I think it's also really interesting, MAs can also draw blood. So I find a lot of similarities actually between MAs and, nurses, because we're frequently kind of bouncing back and forth between, being on the phone, helping make appointments, and then also things like drawing blood, lab tests, taking vital signs, and MAs are able to do all of those things as well. So we really, as nurses and physicians, count on MAs to help us and our patients day to day.
Lovely, perfect. I think this really gives me a lot of clarity, but at the same time, there is one role you have mentioned, nursing assistants or nurses, but there is one role that I kind of get confused a lot of times whenever we talk about these roles in comparison to medical assistants, and that role is patient care technician. And the confusion is that it's literally the same certifying body, NHA. They offer patient care technician certification, and they also have a medical assistant certification, which is CCMA, and we offer both of those certifications. Now, when I look at the content is pretty much the same as well. but I really want to understand how these two roles are different from each other, practically speaking, when you are in those roles.
Sure. Patient care technician versus MA is really just kind of what we were talking about before. So while there is some overlap, um, the MA is able to do more. So a patient care technician is strictly really focused on patient care. It sounds quite simple, but it's very easy to get pulled into administrative or miscellaneous tasks. So I would say that that's the primary difference in terms of what you're expected to do day to day for your job. Where it really differs, CNA versus MA versus PCT, is the education required. For example, the amount of like hours in classroom training. So to my knowledge, CNA is actually the highest. Um, in terms of education. So, for example, like in California, which is where I'm based, they need 60 hours of classroom training plus 100 hours of supervised clinical training, which adds up to quite a bit. When you're comparing it to the MA portion, which is significantly less. However, something interesting, I think, to keep in mind, and again, this is just specific to California. I'm just going to tell you where it is based on me. While the CNAs, require a lot more classroom training for their education, in terms of wages, they actually make a bit less than MAs. But keep in mind, medical assistants are able to go beyond just patient care, right? So now we're asking them to do admin plus patient care, hence the change in the wages and things like that and potential outlook. I do think though that in terms of jobs, there is a lot of openings for both. So it's really preference, right? Where do you see yourself? Where do you think you could thrive? Do you strictly want patient care? Or do you want to be a little more of an integral part of the healthcare team? So those are some things that differ. Um, and yeah, I would just say, in terms of like training length and applying, like you said, for specific kinds of programs, that those are really the main differences that I see.
Perfect. And what kind of settings does medical assistant normally work in? So, like, is it just the hospitals, or they also have opportunities at other clinical settings as well?
Oh yeah, there's a number of different opportunities, and I think it's really great to think outside the box. I know myself when I was in nursing school, we were kind of initially taught to think that the only place for us was in a hospital or working for a physician in an office. And I think that coming into this healthcare field kind of new, as any kind of provider, that's typically where your brain goes. But there are a lot more opportunities, and I encourage you to think outside the box. There's outpatient care centers, which patients are coming in just kind of for the day. Perhaps they're getting an infusion or a quick procedure, and then they're heading back home. Insurance companies also hire medical assistants. Physician offices, like we were saying, definitely hospitals. There's really, anywhere that a nurse or any kind of healthcare provider can work. An MA can work as well. Even sometimes labs, like different kinds of bigger name medical laboratories that I'm sure come to mind if you've ever had a blood draw done. They also hire medical assistants as well.
Perfect. And one thing that I think somebody asked, and that is pretty relevant to what Ashley was answering previously, and this is my understanding, and Ashley, you can correct me if I'm wrong, but the difference between a CMA, which is Certified Medical Assistant, and CCMA, Certified Clinical Medical Assistant, is pretty much similar to what you said, where Certified Medical Assistant are basically more focused on the administrative tasks. That's their priority. And when we look at the certified clinical medical assistants, they are supposed to do both the things, administrative tasks as well as the clinical patient care related tasks as well. Do you think that's the fair way to say it, or are there any other differences as well?
Well, I think it's important to note that we were also previously talking about CNA, so certified nursing
Oh,
assistant, and then
yeah, yeah,
there's
that's different.
certified medical assistant. So
Yeah,
just
yeah, yeah.
knowing that, while, like, again, there's a lot of overlap in these scopes, and we're using a lot of different abbreviations. Welcome to the healthcare field. So just knowing that those CMA and CNA are two different areas. Yeah, I think it's all, again, pretty relative in terms of what we were just talking about. So it all applies.
Perfect. So I think you have kind of touched upon this topic, but just to dig it deeper, what kind of job trends do you see currently for medical assistants? Do you think that there are a lot of jobs that are available out there? And what kind of future outlook do you think this same role is going to have in, say, 5 years or 7 years?
Yeah. I mean, I don't know. I found this kind of interesting fact that I wanted to present to you guys, that was recently put up through a university. And it's, one, medical assistance. It's one of the fastest growing careers in the US, which is great to know. And the Bureau of Labor and Statistics projects an average of 123,000 job openings, in between 2020 and 2030, just for MA alone. And I think, just to go back a bit to what we were talking about in terms of working in a hospital or in a clinic, I don't want to just breeze past that, because I do think that there's a lot of interesting places that an MA can work. Some of which we talked about, even like chiropractors' offices, those are fair game as well. But I want to point out that for hospitals or ambulatory, like outpatient centers, walk-in clinics, physician offices, there's so many different kinds of um, work to be done in there. So, an obstetrics and gynecology practice is going to be obviously very different from like a walk-in urgent care. So you have to kind of be aware of what you're looking to do, and what area maybe interests you, and go in from that. I do think in terms of uh, job placement and where you're able to work, I think obviously, the where you're going to find maybe the most amount of jobs listed would clearly be at like big institutions. So teaching hospital, bigger organizations like that, they typically have multiple listings. Whereas think about it, like a chiropractor's office or a private physician, they may only have a need for one opening, when it comes available and somebody steps away from their role. So they're definitely possible, but they do take a little bit more work to find. I also think that starting in a hospital setting will give you really great experience, especially for your first year. And then you're typically a little bit more, I would say, you have more skills. So it will only help your future employment and career outlook, because you've experienced so much kind of right at the start of your career. So something to think about. But, I've certainly broke many of the like career rules that were kind of in place, for my own section in being a nurse. So I just encourage you, if something speaks to you, just go for it.
Yeah, that's great. And like, with all these opportunities that are out there, right after you are done with the certification that maybe we are offering or maybe another institute is offering, what kind of career advancement pathways people can look at? From if they start with medical assistant and that's their first step into the healthcare sector, healthcare field, what kind of opportunities they can have in future, what kind of certifications maybe they can do additionally, and get more opportunities and grow in this career.
That is an interesting question. And I have to say, I mean, one, like, the sky is the limit, right? So, for example, I've started with patient care technicians that then worked to become a certified nursing assistant, that then loved that patient care and seeing what the nurses did so much, that then they went to nursing school slowly while they were working. And now they're nurse practitioners. So, it's just, there's so many stepping stones, there's so many different areas. It really is just how far you want to go, and how many courses you're willing to take, and how far you want to push your education. But yeah, I would say, MA is considered more of like a midpoint. So for example, like if you're a certified nursing assistant, there's often a bridge program to get to an MA. So just like, now if you're an MA and you want to move to kind of a higher, ranking position or something with a little more responsibility, you can certainly just bridge your program. And the beautiful thing about what we were saying before, a lot of our programs are similar in terms of content because it's all building blocks to just keep advancing. So that's why I think it's really great that if are mastering the world of being an MA and you're still interested and you want to continue to learn and grow, see what else you can get into. And I think just being aware and perceptive when you are at work, seeing kind of who you look up to in the field, or who's, maybe influential to you, or, in an authority position. And if that's interesting, pick everybody's brain. And that'll really dictate, I think, where your career should go for you personally, more than just kind of like stacking up, like, I should do this, I should do that. So I hope that makes a little bit of sense, but you'll
No,
be
no.
guided in the direction I think you should go.
Yeah, and as you said, and I think you were spot on when you say that you should keep exploring. Don't think of it as a nobody is going to give you a roadmap, or even if somebody gives you a roadmap, don't just stick to it. Keep your eyes open. Keep listening to everybody, and there would be some opportunities thrown at you which you might not even think about, and you should take them up if they are interesting and you think you can grow into those roles. But one thing that I'm just thinking is like, are you going to say something, Ashley?
No, go ahead. I'll let you finish, and then we'll go back.
Okay. So I was thinking about EKG and phlebotomy certifications that are there. Um, So if there's somebody who is a medical assistant, I think they still perform a little bit of duties which are relevant to maybe EKG technician's role and phlebotomy technician's role. But if they have those certifications in their portfolio, would that help them grow? Would that be considered as a career advancement for them?
Sure. Yeah, so there is definitely specialization within being an MA, just like it is for nurses. Um, so, if you are really interested in blood draws, yeah, you should definitely start looking into phlebotomy placement and any additional certifications you can get. I think I always am a huge proponent of getting additional certification for anything. Not only that will help you advance your career, but anything that is of interest to you personally within the field, because it may just open a door later. You have this additional certification that somebody else does not, and therefore you're a bit more qualified. So yes, you can certainly specialize. There's a lot of specialty certifications that you can get in anything, from pediatrics to, what have you, phlebotomy. I wanted to mention too, I think being a medical assistant, there's a couple of other ways that you can advance your career too. Like we mentioned, there's not a roadmap, but there are a lot of options for you to draw your own roadmap. So, definitely, like, we start with, getting certified as an MA, and then getting some experience, right? And while you're doing that, you can choose to specialize. So maybe really figuring out what your niche is, and then figuring out kind of any additional specialty certifications. Then also maybe it's for you to train other medical assistants. So that's something that you could do, and that's a whole different career path, becoming kind of like a professional trainer for new employees. A lot of people really enjoy that. Some people do not like it at all. So this is kind of why, you can't really just dictate somebody's path. I think another interesting one that's a possibility is becoming an office manager. So if you really like the admin side of becoming an MA, you can, start looking towards something like that as well. So you're more of a strategic scheduler, planner, kind of running the office as a whole. So that's another goal that you could potentially work towards. And then lastly, just getting more education and really a whole new career pivot. Like I said, maybe you work with a specific person that's a nurse or a physician or what have you, and you decide, I'm going to go back to school for that. There's no such thing as like having done too many roles in healthcare. I think it all prepares you to just be an excellent provider.
True, true, and even like with those opportunities, somebody can feel that maybe maybe they feel more excited about a role like surgical technologist, and they start as an MA, and then they feel like, oh, maybe that is something that I want to do, and they do a certification in that. So you can always switch. In terms of medical assistants and the trainings that are offered for medical assistants. What do you think are some pros and cons? Yeah, let's start there. What are the pros and cons of doing the trainings online? Because that's what we do.
Yes. I mean, I don't know. I'm doing a virtual webinar right now and I work from home, so maybe I'm a little biased. But I think in general, having originally trained for the first portion of my degree, like I was a diploma prepared nurse, and then I got my associates, and then I got my bachelor's. So I did my whole bachelor's online while I was working night shift as a nurse. Um,
Wow.
so I love the flexibility and convenience of virtual learning. I think it takes out a lot of the excess time that you would normally put in to train for a program like this, traveling to and from the center, just kind of all of that is taken away. So that's more time that you can allot to personal things or hopefully your studies. So I think that that's great, but I will say there are a few caveats with virtual learning. I don't know that it's a con, but I think you have to assess your own learning style to know if it's for you. So one, I think you absolutely have to be self-motivated and organized to be able to succeed in, a bit of a virtual environment. You have to have a little bit of self-discipline to know that you're going to make yourself show up because nobody's telling you to be somewhere at a certain time, other than maybe online. And the other thing is, just like with any program, but I think more so virtually, you will get, you will only get as much as you put in. So really being engaged, asking questions, scheduling, coaching sessions and trying to learn as much as possible. In these programs, that's where you're really going to get the most bang for your buck. So I think I also tend to think that the online programs are a little bit more comprehensive, meaning that there's been a little bit more time and care and updates in my experience, seeing how different companies operate. I think that there's more TLC that goes into these virtual programs and they're updated more frequently than some of the programs that are done in person. Sometimes, they're just kind of cranked out year after year, and maybe there's a few updates here and there. But yeah, I think between the slide decks, the coaching sessions, the video portions, things like that, you're just getting so much online. And depending on what type of learner you are, that can make a difference as well. Like I'm very visual, so I really enjoy seeing slide decks and watching a speaker talk and then getting to see, video clips and all of this. And I think in trying to develop virtual content for education, we take all of that into mind. into account. Whereas if you're sitting in a classroom, sometimes it's just you listening to the teacher, which doesn't work for everybody. So yeah, I think we just give a few more options for a virtual program.
True, and I also think that, when you are in a virtual program, it gives you a room to, sometimes you're just demotivated and nothing is making sense to you, and you just want to take a break. You can't do that in a classroom. I think I have never done that in my life. You can't
Sure.
say to the instructor, "I need a 5 minutes break. Can you stop? Can you pause?" No, you can't. You can't ask them to. I mean, you can ask them to repeat something, but you can't do that 10 times. I mean, the instructor can say that you can ask it 10 times, but you can't do that. And similarly, if there is something which is really, really confusing, when you are online, you can literally go to Google, ask that same question to Google, um, get more information about that same concept and clear out your confusions. We also, like on our platform, we also have a virtual assistant, which is basically AI, and you can ask them questions, and it can give you the answers, and maybe you want to challenge something, and you are curious to know about something which you might just shy away from asking to the instructor, but you don't need to be shy to ask it from AI, and you can ask it and it can give you, hopefully, the right response. So I think there are a lot of benefits, but not to say that there are no cons. A lot of people do like the interactions that they have in the classroom with the fellows, with the instructor. But it's really the matter, what really works for you, because a lot of people have their jobs. Some of our students have their full-time education going on simultaneously, and that's why this program works for them. And that's most of the people. They have something else happening in their lives, and they still want to do these programs.
And
I
that's
think
where
that
I
is
think
great.
it fits in great. For a lot of us who are, trying to have a work-life balance and family life balance and all of that, these virtual programs are really just quite versatile. And they fit in, I think, easier to your life at this point, than maybe when you're, just starting out and going to school. Maybe it's easier to just kind of dedicate 100% to showing up every day somewhere to get your education. But this is just, I think there's a lot of versatility and flexibility. And I really like the point that you brought up about if something doesn't make sense in a virtual classroom, you can pause and in real time look up a little more information. If it's not sinking in, and either save it for later or ask a question that perhaps you wouldn't have asked. So I think that also really enhances the learning experience in real time.
Yeah, and the idea how internet has so much information, and I don't think it's possible to not find enough. I mean, you can find a lot of blogs and written notes, but you can also find a lot of YouTube videos on any topic whatsoever, and you can
Mhm.
start listening to one person. And you're like, okay, first 1 minute, you're like, no, it's not making sense to me. It's not interesting. Log it off, go to the next one. And you have so many options available. So I think that's another benefit of the online learning. You can probably not do that in the classroom, asking the instructor, "Can I put on my headphones to listen to somebody else explain the same topic?" You can't do it, of course. On online programs can give you a lot of these opportunities. In terms of what the students are supposed to learn, so the education and the training side of medical assistants, what are some of the major topics, and things that they have to learn during their training, as a medical assistant?
Well, I think one, just kind of breaking it into two sections of duties are helpful, because that will kind of dictate, where your curriculum will come from. So one, for your clinical duties, you're doing a lot of patient care, right? So things like taking histories and learning how to take vital signs and communicate with patients and caregivers, and also learning how to communicate within your own healthcare team, administering medications, things like that. So that's one bucket. And then the other bucket is administrative duties. So, like we talked about, billing, maintaining records, documentation, scheduling appointments, things like that. But again, in terms of the curriculum topics, it's really quite similar across so many of these healthcare provider courses, especially in the beginning when we're building your foundation and we're giving you your essential building blocks. So yeah, you will go over things like anatomy. So, just the total structure of the body and every organ system and how it's supposed to work and what happens when it malfunctions, and how we can step in and intervene. Medical terminology, which is absolutely crucial for an MA role, because, like I said, you're on the clinical side, patient care side, but also on the admin side. So you need to know everything from billing terminology to patient terminology. And then learning things like procedures. And like I said, I keep bringing up communication because it's so, everybody really takes it for granted, but it's so critical that we learn some great techniques and perhaps even barriers to proper communication between ourselves and patients or caregivers, and between ourselves and our peers and the rest of our team. So those are some
Um,
things that you can expect.
Yeah, and what do you think is the most critical thing as a medical assistant? So when somebody is thinking about becoming a medical assistant, what is that one thing that you think is the most critical aspect of becoming a medical assistant? And anybody who is learning or who is thinking about becoming a medical assistant, and I'm sure everybody envisions themselves in that role while they're learning everything. So what is that one bit that they can think of more and prepare for it, because that can be a challenge when they go into the field.
Hmm. I do think medical terminology is probably really difficult to grasp for everyone, because it's a slew of abbreviations and really technical terms that maybe you've never heard before. So one, I would say be patient with yourself, because technically those things, while they're the most important, um, one of the most important things to learn, it does come easier with real hands-on experience, so real world training. But I do think the more you can get your hands on that kind of stuff, start making yourself flashcards, it will sink in deeper and deeper, as you progress in the course. It will make more and more sense, where 90% of a stack of terminology cards that you make perhaps at the beginning of your course, 90% of it will not make sense to you, and that's okay. That's expected. But then as you go maybe halfway towards the course, maybe you understand about 40%. And then as you complete the course, maybe now you understand about 80%. And then you'll get out into the field and you'll already have all of that under your belt, and you'll gain the rest of it kind of on the job.
That's very interesting. And I think that this probably takes us to our training program that was developed by one of our SMEs. And recently, Ashley helped me kind of review that program and make enhancements to the program. And I think we can probably now share a little bit about the program that we offer. And where, all these things that Ashley has talked about, you guys can learn all those concepts. And one very interesting thing that I think a lot of you would be excited about is that Ashley is also going to be a coach for our medical assistant program. So you can probably schedule the one-on-one coaching sessions. I'm going to talk about the one-on-one coaching sessions in a bit. But you can schedule one-on-one sessions with Ashley, and she'll be there to help you answer your questions. And these can be any questions. She might not have answers about the technical questions about a particular state, but she would always know where to go and find the answer for you guys. But when it comes to theoretical understanding of how the role is going to be and any concepts that you are struggling with, he'll be there to help you guys. So just keep that in your mind. And with that, I will share my screen once again. And we are now going to look at our medical assistant program. So when it comes to the medical assistant program offered here at HTA. This is Certified Clinical Medical Assistant certification that we prepare you for, and this is offered through NHA. The duration of the program is 16 weeks. Now, bear in mind the 16 weeks is a tentative number. Uh, we assume that if you're spending about 10 to 15 hours a week, you would be able to complete the program in 16 weeks. For some students, it can take longer. For some, it can take shorter. It really depends upon your pace, because these are self-paced programs. We don't force you to complete it sooner, but we make sure that you are making at least some progress every month. So if you're making no progress, then you are definitely going to get a call from the student services, and they're going to ask you if everything is all right and if they can offer you any kind of support. But otherwise, it's pretty much self-paced. You do it in your own schedule. It's pretty flexible because everything is online. In terms of the tuition, the upfront cost of the program is $3,450. But the monthly installment options start from $266, which is, I think, quite affordable. And if you pay upfront, you get, don't quote me on this, but I think you get around $550 of discount. Yeah, that's the number. You can read that on the website. And we also have some of the credit options available as well. We have a study now, pay later option as well. All of these tuition options are available on the website. So I would suggest that you should go on the website, go onto the medical assistant program page, and find all of this information. In terms of the eligibility, there's no issue, no additional requirements. You just need to have a high school diploma or any equivalent qualification. You just need to have an internet, and you should also know how to use internet and how to use a laptop, because that is going to be important for you to navigate through our dashboard. In terms of the offerings, all of our program is self-paced and it's online. You get access to our online dashboard where you have all of your slides, where you schedule your coaching sessions, videos, discussion forum, the virtual assistant, the AI that I was talking about, and everything is there on the dashboard. You have one-on-one coaching sessions. One-on-one coaching sessions are basically offered to make sure that if you have any issues, you can get in touch with an expert from the industry, somebody like Ashley. And for medical assistant, you will have an opportunity to schedule a session with Ashley, and you can ask them any questions about the topics that you are struggling with. But remember that um, these are not instruction sessions. These are not your classes, your live classes. These are coaching sessions, and coaching is most of the times led by the person who has scheduled the coaching session, which means it would be an expectation for you to come into the session with your questions, with your confusions, and then Ashley can help you sort it out, or any other coach for that matter. The program fee also includes a certification exam preparation course, which is available through NHA. It's an official exam preparation course that you can sit for before actually appearing for the actual exam. So that you can look at your preparation, and if you don't score well in that certification exam preparation course, you can redo your training to make sure that you are up to the mark with your learning. Career support is offered through our career services team, where you can schedule 2 career services sessions. By the way, the coaching sessions, you can schedule 5 coaching sessions with the coaches, and these are mandatory for all of our students. And you can schedule them, these are on demand, so you can schedule them whenever you think there's a need for them. Career sessions, which are 2. The first one, you are eligible for it when you are done with 50% of your program, and career advisors reach out to the students themselves. And the second one is done once you are done with your training program completely. And these career services sessions are focused on helping you with your resume, with your LinkedIn profile, with your job opportunities, wherever you have to apply. They also give you a list of job sites where you can apply. So that's the kind of support that you will have through career service advisors. And whenever and wherever you will be applying, and you will have any difficulties, the career service advisor will be there to help you with it. This program cost also includes the ebook. So you are given an ebook for the program, and we encourage the students to make sure that they're reading the corresponding ebook chapters for all of the program. Don't miss out on the information in the ebook, because there can be something which it has not been shared in a detailed manner during the slides and during the online program. So make sure that you're reading the ebook and you're understanding everything properly. Then we also have skills videos. So there's some of the things which you will be performing in the clinic, and you can probably not envision how it would look. So for that reason, you have skills videos where you can observe how things are done. And at the end, we also have exam voucher, which is included in this tuition. So whenever you complete the program, you pass the certification exam preparation course, which means that you will complete practice exam, and you will have to score more than 85% in that. And if you score that, you will be eligible to get the exam voucher through HDA, and you don't have to pay anything separately for that. For some of our programs, actually, do you have something to say?
Oh, no. Well, yes, I guess you asked me what I thought one of the most important things was, for an MA or a CCMA now. And honestly, I just guess I took it for granted. But yes, exam prep is probably the most important thing. And, as we're going through our offerings and such, that's definitely what I want to really drive home to you guys, in terms of, I think, the value and the versatility that we were talking about before. Our whole goal is to really prepare you enough, so that way you can pass the exam and feel comfortable and be able to perform these skills. So between, the ebook, the modules, prepping you for the exam with quizzes and exams, as well as, the career support, through additional meetings and stuff with the coaches. All of this really helps prepare you to, prepare and pass your exam. So that's, yes, if I had to go back and answer that question again, that's what I would say. I think, there's like, what's the most important thing in terms of once you have your job? And I would say medical terminology, but I would say at this point, if we're here in this webinar, the most important thing, that we want for you, and then I think you can achieve through this course easily is, the certification exam prep and passing of that.
Absolutely. I think that was very important, and I'm glad you mentioned that, because we have seen some of our students, rushing the course because they think, oh, it's not that difficult. But then when they actually appear for the exam, that's when they realize that they have missed some of the things which were very minute details, and they have missed them because they were rushing through the course, they were rushing through the ebook, they were skimming through the ebook, they were not reading it properly. So we don't want you guys to do that at all, because that will only waste your time and money, and you won't pass the exam. And one thing which I think I would absolutely suggest everyone who is thinking about becoming a medical assistant is that for some of our certifications, there is a requirement to do some clinical hours. For medical assistant, there is no requirement as such to do clinical hours, to do hands-on practice. You can appear for the exam and you can pass the exam if you do everything that we have just talked about. But if you really want to do better, and if you really want to be more comfortable during the exam and also as a medical assistant, we highly recommend that you try to find an externship site, try to find a clinic around your area, wherever you live, and see if they can offer you maybe 15, 20 hours of clinical practice. And this is not something which is rare. This happens very, very normally. It's not a requirement. So for that reason, you don't really need to worry about the number of hours. Even if it's just 10 hours, it will give you some of the learnings which will be helpful for you as you start your career. And they will definitely be helpful for you when you'll be sitting for the exam. Because at the end of the day, the exam is all about how you would react, or how much you know about the role, and things that you have to deal with on daily basis in that role. So I highly recommend that you try to find an externship site while you learn everything online through HDA.
I have a quick question or something I guess we should point out. So I see that our restricted states are listed here, but Jessica did ask if we are accredited in Arizona. Do you want to speak to that?
Yes, absolutely. Thanks for mentioning that. So, in terms of the restricted states, let me, give the context for those who don't know that for some of the states, some of our programs are not available, and that's not because the students cannot be certified in those states. They can be certified, but those states do not accept that certification in order for people to work as medical assistants in those states, or for any other role. For example, for these two states for medical assistant, if you are certified through NHA, you will find it very, very, very difficult to find jobs. And for that reason, we do not recommend you to complete the program if you're based in one of these states. When it comes to Arizona, the program is if you're asking if the program is available, so but through the Arizona State's website, this is absolutely clear that we can offer the program in Arizona, and NHA is accredited as a certifying body through NCCA. So if you pass the certification through NHA, you will be an accredited certified medical assistant through NHA, which again is accredited through NCCA. I think that probably answers your question, but if you still have something else, do let me know and I can answer it. And these are some of the testimonials. You can read these testimonials on Trustpilot about some of our programs. You can also go onto our YouTube channel and you can find some of the video testimonials that are posted from our students as well. The idea is for us to make sure that we are doing our best to help our students achieve their goals, the professional goal, and for most of the students, that is to pass the exam and find a job. And we try to help you in every possible way to make that happen. And that brings me to the end of the session. And I think if you guys have more questions, keep sending them in the chat, and I'll be more than happy to assist you with it. All right, Jennifer, I think you have your hand raised. Unfortunately, during this webinar, we do not have the feature to allow the attendees to ask a question and unmute themselves. So I'm here. I mean, all eyes on the chat box. You can send your question in if I haven't answered it already. All right, and
Yeah, if you guys have
Jessica,
anything, throw it in the chat. We're happy to take some time to answer any questions that you might have. So like Danish mentioned, just throw it in the webinar chat, and we can go from there if you guys have anything that maybe we didn't cover or you're curious about.
anything, like, even if you want to ask something to Ashley about her career, something that you guys can learn from, feel free to ask any questions. And in terms of what's next, if you are interested in enrolling into our medical assistant program, you can use this QR code, which takes you to a small, I think it would be a small form that you'll have to fulfill. And then the session would be scheduled with our admissions team, and you'll be assigned an admission advisor, which will help you. And I think that's pretty much it. We are going to wait for another couple of minutes. If we get any questions, which I don't see at the moment, there are no further questions. Even if you forget to ask a question right now, or you don't have a question right now, and you have a question maybe in 15 minutes or in an hour or tomorrow, whenever you have any questions, feel free to reach out to admissions@healthacademy.org or sport@healthacademy.org. All of these emails are available on the website. We also have the admissions contact details that are mentioned on the website. We also have a chat box on the website. So there are a lot of places where you guys can get in touch with our team, and our team will be available to help you in every possible way. And I think that takes us to the end of our session. So thank you so much, everyone, for joining in. And especially, Ashley, thank you for taking out the time for the webinar. It was really nice talking to you about the medical assistant role. And I'm really excited for your coaching sessions with the students for the medical assistant program.
Thank you. Yes, I look forward to seeing all of you, hopefully. And like, we mentioned, if you have any questions, after this, please reach out to us. And I did share a little bit more in-depth information in the chat there for you, just digging in a little bit deeper to CCMA versus CMA. So if you're interested, definitely take a look.
Perfect. Thank you so much. Thank you, Ashley. I'm just going to give another 10 seconds for anybody who hasn't seen that link in the chat box. So have a look at that, copy it. Thanks, Jessica. Thank you. Have a great day. All right. Take care, everyone. Bye-bye.
Bye. Thank you.